So, now with Dr. Beatriz Molina, you're doing
there.
a anti-aging eye treatment, would that be right?
Yes, it's one of the most popular treatments at the moment. I think a lot of people don't realize that it's a possible treatment to be done. We got a beautiful 43-year-old lady who looks really good for her age. She has no treatments before, and she was just telling me that she looked a little bit tired, and it's what we call it a tear trough treatment. So, which is just the line which goes from the middle of the eye and it crosses around your cheek, and it just makes us look tired even when we had 12 hours of sleep. So what we do is a very simple treatment. We do a very small injection, as we can see in here, on the cheek, and we just do a very little amount of lidocaine so it doesn't hurt. Then we put a very small needle to do an access point, and we use a cannula, which is like a blunt needle, and we can access from here all the way up to here very safely without causing any rupture of any of the major blood vessels or any damage to the nerves. And then we can just place the product along this area to increase a little bit. Because as you can see on this side, if you look inside here and we do that little push, what happens? Disappears. So it's really a little bit of a mid-face enhancement.
What about the bags under your eyes? You know how you see a lot of those people and they look tired? It's not the panda eyes, but you know, the fluid
It's
under there.
slightly different, but it's really effective, and it will be my second choice on her. So once you feel the tear trough and you got the support of the arch of the eye, then we go very carefully and put the product along that rim, just very subtly, and then just lifts up.
So how many treatments would someone need to have in order to correct that?
If you are experienced, you can do it in one treatment, but it depends obviously on the patient. Sometimes because of the elasticity of the skin, and if we got a little bit more mature skin, we do it over 2 treatments just to make sure we put a little amount, let it settle, and then we can put a little bit more afterwards, because obviously the patient is happy as well. It's not been too much work done in one go, and you are creating what we call it a sandwich technique. So you just really, like an scaffolding, you're putting a good base and building up very, very gently.
So you've treated one side of the face?
Yes, we're doing a little bit, it's nearly finished, but we can actually have a look, because this was actually her bad side. So this was the very worst. This one was not very bad at all, and normally we're supposed to start on a bad side because it's obviously easier to match the other side. So we're just doing a little bit so just to see what it is about. But it's not totally finished, but it's good enough to probably have a look.
Great. So, okay, Penny, do you want to just sit up for us so we can see?
So we can just see
and how
here.
long will it last now?
About a year.
So she's got a full
Normally
year
after
on that.
1 year we do a little top up.
It's a reasonable
and we put
treatment.
less than 1 mil at the moment, so it's a very small amount.
Great, you can really
You
see a
can see a
difference there
really
between
good
both.
difference,
Yeah.
particularly on the subtle side profile.
Great. And how much would this
So look-
cost, this type of treatment?
Around £650, depending on obviously patients and amount of product used, and obviously physicians' fees.
Great. Well, thank you so much for
love it.
showing
You're
us
very
that
welcome. Thank you so
fantastic
much.
treatment.
Great.
Right.